Well, hello everyone, and it is so good to see you on today. Welcome to Birmingham Bible Church's Winning Wednesday, and we are praying that you are having an awesome day on today. We like to thank you for joining us for another time that we are able to bring a guest on to actually give you some great information, to empower you, to encourage you, to help you know that you are a winner and to help you win in certain areas of your life. We want to make sure that you have victory in your life. And on today, we have someone here who is coming on who is going to help us to be victorious in our health. So listen, y'all know how we do it. We need you to tag 3 people. We need you to text 5 people about this broadcast on today. We want you to share it on your pages. For those of you who are watching on Facebook, we like to welcome you. Thank you for joining us. For those of you who are on YouTube, on Instagram, on Twitter, and to our One Place family, thank you so much for joining us on today. Well, this past Saturday, which I did not realize was National Dentist Day. And so, of course, people I'm pretty sure are in their own way celebrating their dentist, maybe not when they actually go to the dentist, but we have to celebrate them because they keep our mouths healthy. And then I didn't realize that February was National Children's Dental Health Month. So excited about all of the different ways we are celebrating oral hygiene this month and just really making sure people are aware of how important it is to have great oral health. And so when you think about your mouth and you think about going to the dentist, a lot of people think, well, I want to have a nice smile. I don't want to have, yellow teeth. I want to have a pretty smile. But having oral hygiene is more than that. It mirrors your body and it makes sure that you're not having any serious health issues that can come about when you don't have good oral hygiene. And so I am excited about our guest on today. Her name is Dr. Chelsea. She grew up in Cummings, Georgia, studied biology, played soccer, earned her doctorate in dentistry from right here from UAB School of Dentistry. She worked in undeserved communities in Bibb and in Tuscaloosa counties. She worked in private practice, and I'm so excited because she also works with our dentist, Dr. Frank Malazzo at Caldwell Crossings Dentistry. And so she's also the dentist of our 2 younger boys, Caleb and Elijah. But she is a sweet person, great person. And so I would like to introduce to you all Dr. Chelsea. I'm going to let her say her last name because she said I can call her Dr. Chelsea, and I don't want to mess it up. So hello, Dr. Chelsea. How are you?
Hey there, it's good to see you. I'm good.
Good
Thank
to
you so much for having me on.
Oh, definitely, definitely. So I have to ask this question before we get started because out of all the careers, I mean, you have to stay in somebody's yucky mouth all day, every day. So tell me, what led you to choose this particular career of dentistry?
So I always knew I wanted to do something in healthcare. And actually, one of my older cousins went into dentistry, and I talked to him about it, and he really encouraged me to find a dentist near my college and just kind of go shadow and see if I liked it. And so up in Spartanburg, I had the privilege of shadowing a UAB alum, Dr. Shirley, up there, and he just let me see everything and really taught me a lot and he used to volunteer at a free health clinic once a month, and he told me, if you can handle it today, you can handle dentistry, because it was a lot of extractions and
Yeah.
a lot of yucky mouths and blood, and I really loved it. And so after that, I applied to dental school, and thankfully I got in.
Wow. Yeah, you really have to like it. I remember when I got my root canal and the guy said, I have a TV screen if you want to look at it. I'm thinking, I don't want to look at that. So you
I
have to
know.
you got to be called for this. You really do.
Yes.
But yes, Dr. Chelsea, if you could, you can start your presentation and talk to us about oral hygiene or whatever you have laid on your presentation on your heart. You can go forth. Yes, ma'am.
All right, give me just a second to share my screen and I will get started.
That's fine. Make sure I have you on.
Okay, can you see my screen?
Yeah, see it perfectly.
Okay. All right, so like Miss Mason was saying, my name is Chelsea Maniscalco, is how you say my last name. It's a tricky one. That's the main reason I go by Dr. Chelsea everywhere, because Maniscalco is a tough last name. So I'm going to be talking to you guys about oral health and dentistry and just some common questions I tend to get with patients that I wish I could spend a little more time on that I don't always get a chance to. Miss Mason covered most of this, but like she said, I grew up in Cumming, Georgia. I went to Wofford College, which is in Spartanburg, South Carolina. I graduated from UAB School of Dentistry in 2017. And I did the National Health Service Corps for the first 3 years of my practice, which is where I served in underserved areas in Alabama. And now I'm in private practice at Caldwell Crossings Dentistry. I ended up marrying one of my classmates in dental school. This is my husband, Lee. He is an oral surgeon in Hoover. And this is our little girl, Amelia. She's just over a year now. And then this is our wonderful team down here at Caldwell Crossings Dentistry. And just to give you a little overview, I offer restorative, which is like fillings, fixed and removable prosthodontics, like crowns and bridges, and partials and dentures. And I also do endodontics or root canals and oral surgery, like I take out teeth, and I work with kids, and I like to do cosmetic dentistry, like if you ever want to have veneers done or just restore your smile in any way. And then I also offer Botox and filler. So like I said, I'm just going to talk about some common dental and oral health questions that I get. So the first one is, what causes cavities? So there is a bacteria in your saliva that naturally occurs called strep mutans. It's in everyone's mouth. There's nothing you can do about it. It's there. And whenever you combine that with a fermentable carbohydrate like sweets, candy, anything with sugar in it, it causes a bacterial film on your teeth. And that bacteria releases acid onto your teeth. And that acid is what causes you to have cavities over time. So if you've ever heard the term plaque, what we're talking about is the bacterial plaque that is on your teeth. So how can you prevent this? So first, you can neutralize the acid in your mouth. So after you eat something, you can drink some water, rinse your mouth out really well. That helps to balance the pH in your mouth back to a neutral level. After about 5 minutes, then you want to brush your teeth for 2 minutes in the morning and then 2 minutes at night. And you need to floss every day. And I know that is probably everyone's biggest complaint that we tell you about is you have to floss, but it's very important for helping to prevent cavities in between your teeth. And then the last thing you want to do is avoid foods that these bacteria love. And I'm going to kind of go over the different foods to avoid and which ones are better. So high cariogenic foods, cariogenic just means cavity producing, or foods that these bacteria love and help them produce lots of acids. So common ones that you think about are like sweets, sodas, and juices. And then there's also some more healthy things that you don't necessarily think about, like dried or sticky fruits, bread, corn, potato chips, Um, so those are all the biggest things that if you eat them and don't rinse your mouth out, brush your teeth, and it just sits on your teeth all day, you're going to have that acid released onto your teeth, and it's going to make your teeth more susceptible to getting cavities.
Dr. Chelsea, let me ask you this.
Yes.
So if you cannot, if you don't have access to your toothbrush at that moment, would it be a good practice to go to the bathroom and rinse your mouth out with water or drink water? Or
Yes, absolutely. If you
okay.
can drink some water, rinse your mouth out, that is really great. Another thing you want to try to avoid if you can, I know a lot of people like to sip on coffee or tea throughout their day. Try to only drink those kinds of things with your meals. I'm not saying you have to give up soda or coffee or tea or anything, but they're all things that have high acid and high sugar in them normally. So you can have it with your meal, but then afterwards, be done with it. Don't continue to sip on it all day long, because you're just continuing to put that sugar and that acid on your teeth, and it's just continuing to keep the pH in your mouth at an acidic level and make your teeth more susceptible to cavities.
Oh boy, that was for me. I'm a coffee drinker. Okay.
I am too.
All right.
So then these are some more low cariogenic and non-cariogenic foods, meaning they're low cariogenic or less likely to cause cavities, and non-cariogenic are not going to contribute to causing cavities. So low things, excuse me, what are you going to say?
Oh no, I didn't say anything.
Oh,
Sorry.
okay. Raw vegetables, raw fruits, whole milk, whole grain breads, dark chocolate, plain yogurt, and then non-cariogenic foods like meat, fish, fats, and oils. But one thing I will note here, because we see this a lot with kids, because my daughter is drinking whole milk right now that she's over a year old. And obviously they need to get 16 to 24 ounces of whole milk a day. And that can be tough to do for some kids. But do your very best to just give them that whole milk at their meals, just like with your soda or your coffee or your tea as an adult, because you don't want that milk sitting on your child's teeth all day long or overnight, because even though it is a lower risk for cavities, it still can contribute to cavities if it's sitting on the teeth 24/7. And before I had Amelia, I really didn't understand why you would need to give your child milk in between, but now I understand more. So I know that that's a bigger battle than just saying, well, you can't have it right now. But just do your best with it. And if you can, at least like give your child a sip of water after finishing the milk, if you do have to give your child some milk in between meals.
Well, Dr. Chelsea, I'm also looking at the list of foods, and it's so ironic that these are the same foods. We've had health professionals come on and talk, and all of them have said, like, the foods that you had just listed, the dark chocolate, the yogurt, the whole grains, those are the same foods that they recommend to keep the inside of your body healthy. So it just shows how everything just really kind of works together.
Oh, absolutely.
Yeah.
And I mean, your oral health is so connected to your systemic health. It's, for a long time, we thought that the mouth and the rest of the body were just very separate, and we didn't really think about the connection between the two of them. But there's been more and more research linking oral health with systemic health over the years. So I 100% agree with that.
Mhm.
Okay, and so there's also cholestatic foods, which are foods that can help prevent cavities. So cheese, nuts, and xylitol. Xylitol is a synthetic sugar found in some like chewing gums. It's found in some mouth rinses. It's also found now in, they make like xylitol candies for people. So eating all of these things is a great way to actually protect your teeth. They kind of form when you eat them, they kind of make a protective layer over your teeth and keep the bacteria from being able to release acid onto your teeth. So another thing that I have a lot of patients ask about is, why do I have to get x-rays? You took them last year. Nothing's like, I don't need them every year. What's the big deal? So every 6 months you come in, you have a cleaning, I do an exam, and there's only so much that I can see when I'm just looking with my eyes, and even with my loops that magnify everything, I can only see certain surfaces of your teeth because the way that our teeth are, they touch on the sides, and even with my magnification, I can't see the parts that are touching. So also your teeth are partially covered in bone, so I can't see the root surface of your teeth just looking clinically. And then I also can't see anything that's happening in the bone just with a clinical exam. So those are some of the reasons that we need to take x-rays. And honestly, the only reason we take them once a year is because that's what insurance will allow us to do. Sometimes we would like to take them more than that. And a lot of times I will if I am worried about something suspicious, or if a patient comes in and says, I'm having tooth pain, we're going to have to take an x-ray to be able to see what's going on. So one type of x-ray that we take is called bite wings. These are the ones that we get you to, when you come in, you have to bite down on this little tab, and most people don't like it. And then we tell you to smile and we take the picture. These are used to detect cavities between your posterior teeth, like your molars and your premolars. This is part of the thing that I can't see clinically. It also can show any calculus that's developing below your gum line, and it also shows us the bone level of your teeth in this area. So if you look at this picture right here, can you see my mouse? Okay, so this little wing right here is some calculus right below this person's gum line on this molar. And then this little triangle right here that you can kind of see starting to go into this surface right here, that's a cavity in between those two teeth. So this little lighter part right here is your enamel, which is the outer surface of your teeth. And this darker center is called the dentin. And then this very dark area right here is the pulp chamber, where the nerve and the blood supply of your teeth are. And then you can see right here, this is a filling that someone's had before. Same thing down here. And then all this right here is your bone. So we can see a lot just in this one picture, which is really great. This is a periapical x-ray. This shows me a close-up of a whole tooth in an area, and this could be a front tooth or a back tooth. And we use this to detect infections, look for things like cysts or tumors, and it can show us other abnormalities in the bone. And you can also kind of see on upper teeth, sometimes you can see part of the sinus as well. So this little white line right here is your sinus coming down. And you'll see like a tiny little outline around this tooth. That's something that's normal. Sometimes you'll see like a darker circle associated around the root, and that would be indicating there's an infection forming. And then another thing we take, this is when we have you stand, you come in and you stand and you hold on to this little bar and you have to bite down. It's called a panoramic x-ray, and it goes around your head and it takes a picture of your whole face just about. So it shows us the upper and lower teeth, the maxilla and the mandible, which are like your upper and lower jaws. And it shows you some of the sinus cavities as well. We use this to show us impacted teeth, like your wisdom teeth, detect infections. It can show us abnormalities occurring in your bone, and it can also show if you have some abnormalities in your temporomandibular joint, which is the joint up here by your ear that helps you open and close. So in this panoramic x-ray, you can see that this person has wisdom teeth that are impacted. These are these little teeth right up in here. So typically that's when we send you to the oral surgeon to get those out. And then you can see your sinuses on both sides over here. And then it just shows you all of the bone in your mandible and in your maxilla. And unfortunately in this picture, you can't see the temporomandibular joint, but it would be somewhere up here. And sometimes you can see if someone has arthritis of this joint or an abnormality in the shape. If they're complaining of joint pain, sometimes we can see why that's occurring in this photo.
Dr. Chelsea, let me ask you, have you ever done x-rays on someone and it showed like a more serious issue going on, and so maybe you had to refer them out to like a specialist? Like, have you ever observed that?
Yes, actually. There have been a few times where I've had to refer a patient to an oral surgeon in order to have something biopsied because of something that we caught, especially on the panoramic x-ray like this. Sometimes you'll see like a cyst, or you'll see like a dark area, or you might see a super white area. And if it doesn't look like normal bone like this, then it could be suspicious. And I have had to send some patients for biopsy or to at least be evaluated by a surgeon. I've had a couple patients come back with some not great diagnoses, but some it's just been something that the surgeon has said, we'll monitor this, we'll have your dentist take a panoramic x-ray every year, and we'll just make sure that this doesn't grow or change over time.
Okay.
That's a good question. And then one other kind of x-ray that we actually offer at our office that I wasn't able to put on this PowerPoint is something called a cone beam CT. So it's like it's like a 3D x-ray. It looks a lot like this panoramic, but we're able to manipulate it so we can see all 3 dimensions of all of the teeth, and we can kind of zoom in on an area. And it is really cool because it's very helpful for root canals so that we can see all the different roots of your tooth. Sometimes it can help us detect an infection earlier than on some of these other x-rays, just because it's a little more detailed in what it's taking. And it can show us like cracked teeth. It's a really valuable diagnostic tool. And sometimes it can even show if you're having a sinus infection, because it'll show your sinus is full of something. And we'll say, well, that might be why you're having this tooth pain, is because you have a sinus infection. And a lot of your posterior teeth on the top are in close association with your sinus. And so that's another really cool feature that we have at our office. Not every general dentist office has it, but we're very fortunate that we have that. So I'm very glad that we have it, because it's an extra service that we can provide. So another thing that I have patients ask me is, I've been told I have gum disease. What is that? Why do I have it? Is this just a way for you guys to make me come in more and make me pay more money to get cleanings more often? So gum disease is something called periodontal disease, and it's an inflammatory disease of the bone and gums associated with your teeth. It's caused by a buildup of plaque and calculus below your gum line. So if you remember back to that bite wing, you could see, you might see some calculus like that on someone with periodontal disease. And this plaque and calculus over time causes an inflammatory response in your body, which leads to your gums and your bones receding around the teeth where this calculus and plaque is. And some of the common symptoms that you might see a patient with periodontal disease complaining about are their gums bleed when they floss or they brush. They have recession around their teeth and they can see like the root surfaces. Their teeth are kind of mobile, like they're kind of wiggly and loose. They complain of bad breath, or they just complain that their gums hurt. And even sometimes it can come across as like tooth pain in a particular area. So this is a really important thing to treat. It's not just something that we do because we want you to come in more. It can cause you to lose your teeth if you don't take care of this disease. So typically what you would do in a general dentist's office first is do something called scaling and root planing, which is where we get you very numb and then you come in and we clean out the plaque and calculus that's built up below your gum line, which can be a little uncomfortable if you're not numb. So that's why we numb you. And then once all of that's completed, we start to see you every 3 to 4 months for cleanings. And for less advanced cases, we may be able, after that person is back on a good routine and their oral hygiene has improved and we're not seeing any more signs of inflammation or anything that would cause us to see that the periodontal disease is still active, we may be able to push them out back to regular 6-month cleanings at that point. There's some people that are going to stay on 3 to 4 month cleanings their whole life just because they don't do a good job with their oral hygiene at home, or it's just really uncontrolled and they just need to be seen more often. That's phase 1. Typically, we don't go on to phase 2 until that patient is doing really well with their oral hygiene, but they still just need a little extra help. So we may send them to a specialist called a periodontist, where they can do some kinds of surgical intervention, where sometimes we have to actually cut away some of the gum in order for you to be able to clean that tooth better, just because you've gotten so much bone loss that we can't resolve it. So that is periodontal disease. And down here, you can kind of see a little narrative. Like this is what healthy gums and teeth look like. Your gums are light pink, no redness or bleeding. And this is the bone and it's nice and healthy and in the right spot. Gingivitis is probably the first phase of periodontal disease. And that's just like mainly when your gums bleed, but there's not any involvement of the bone at this point. Then periodontitis, like early stages, you'll see some recession. The gums are really dark red, irritated looking. They've kind of separated from the tooth in some areas. You might notice in someone that has this, like their gums kind of flap when they touch them. And you'll see like plaque and calculus. That's what this is showing right here. And you'll see that there's some bone destruction happening around these teeth. And then in more advanced cases, you see even more bone destruction, even more flapping of the tissue, irritation, inflammation, more calculus buildup. And eventually, if this continues to happen, it'll get to the point where this tooth is very loose and it'll have to come out because it's causing a lot of pain and it can even lead to infection.
Dr. Chelsea, let me ask you, and maybe you'll get to this. I was thinking about writing all my questions down, but I don't know. I'm scared.
Oh, no, this is perfect.
I might forget. But what is the cause of gum disease? Is it just lack of oral care, or is it like there's a health issue that's present? Like, I don't know. I want to say maybe high blood pressure, or is there some type of health issue that may be causing it?
So the main cause is the buildup of plaque and calculus, which comes from poor oral hygiene or just haven't been to a dentist in a while, haven't had your cleanings regularly, and things have just built up. And once it gets below the gums, you can't get rid of it with just regular brushing and flossing. You need more specialized tools. Okay. However, we have found that there is some positive correlation between periodontitis and some systemic diseases. So it is, I can't say linked, but there's definitely some positive correlation between like some different diseases, which I think, yes, I actually do have a slide about this. I couldn't remember if I had put it in here or not.
That's the next slide. Okay.
Yes, so we've seen a positive correlation between cardiovascular disease, diabetes, adverse pregnancy outcomes, and even Alzheimer's disease and periodontitis. So if you have any of these systemic diseases, you're more likely or more susceptible to periodontal disease and vice versa. And one important thing to point out is that periodontal disease can't be cured per se, but it can be halted and kept from progressing further. And like I was saying before, if it goes untreated, it'll cause you to lose your teeth over time. It can cause you to have an abscessed tooth, and if that abscessed tooth is not taken care of, that abscess can cause a systemic infection, cause you to get very sick, have to go to the hospital. So it's definitely something that you want to avoid. And then moving on to kind of a different area, but a lot of people ask when they should start bringing their child to the dentist. The American Academy of Pediatric Dentists recommends that you start bringing your child as soon as he or she gets his or her first tooth, or by his or her first birthday, whichever comes first. Which I know some pediatricians say a little bit later, but we actually recommend that they start coming that early for several reasons. First, it starts to get them used to coming to the dentist, kind of getting involved, and just getting used to the routine of what we do. Because the first time they come, we're not going to do every single thing that we do with you as an adult. We're going to just put them in the chair, let them lean back, maybe pretend to brush their teeth, or let them show us how they brush their teeth. But then it's very important to bring them in so that we can educate the parents, because there's a lot of things that you just don't know. I didn't know until I started in dental school, a lot of these things, and kids don't come with a manual. So you need all the help you can get. And also we check for cavities, and we'll look for any other like abnormalities in the mouth at that point. So it's just really important. And obviously this is a picture of my daughter. She has 2 little teeth on the bottom that have come in, and this week she's had about 6 on the top pop up. So
wow.
We're into the teething stage. And then, yes, ma'am.
Oh, I will say, I'm glad you had this slide, because that was one question I was going to ask you, was at what age should you bring your children to the dentist? Because you're right, it is later than the first birthday. I remember we have 4. And so the first 2, I think we took them at 3, I think it was, but they're like 20, they're in their 20s. And so with the last one, Elijah, he was 2 with a mouthful of teeth, and then he was starting to make this grinding noise. Like literally we will be in the car driving and we're like, what is that noise? And it's him just grinding his teeth. And so
yes,
we took him to the dentist early, because I was like, oh my gosh, something, I got to make sure nothing's going on with his teeth. But I'm glad you did put that slide in, and pretty soon we had to go to the orthodontics and all that stuff. And so but yeah, so I'm glad that slide is available.
Oh yeah, absolutely.
Yeah.
And then another common thing that I've had parents ask me or say is, they're just baby teeth, they're going to fall out anyway. Why do we need to worry about doing a filling on it if it has a cavity, or taking care of something like that? But it's actually very important to take care of your child's baby teeth. We call them primary teeth. For several reasons. First off, decay can lead to infections if they're left untreated, which can cause a lot of pain, obviously. And also it can spread to the rest of your body and cause your child to be very, very sick. So that's one of the main reasons. But also, your baby teeth maintain the space for your permanent teeth that come in afterwards. So if your child loses a tooth earlier than it's meant to come out of his or her mouth, it can create crowding or space issues for the teeth that are supposed to come into that area in the future, which is why sometimes if your child does have to lose a baby tooth sooner, your dentist may put in a space maintainer in order to keep room for the adult tooth that's supposed to come in that area. Another reason is your teeth help aid having those baby teeth in the right area, help form your jaw correctly, because your child's jaw is continuing growing and growing and growing as he or she grows. And we need those teeth to be in the right place to help with proper jaw formation. They're also needed for eating and chewing. I mean, think about if you didn't have teeth, it'd make it a lot harder for you to eat. So your children need it probably even more because they're still learning how to chew and eat and swallow correctly. So they don't need to be having a hindrance or being in pain trying to eat or chew. And also your teeth aid in your speech. They're very important for being able to help your child create different sounds like the S sound, the F sound, really all the sounds. And then another thing is just because it teaches your child how to take care of their teeth. So if they have poorly cared for baby teeth, more than likely they're going to poorly care for their adult teeth. So you want to get your children good habits and teach them that their teeth are supposed to stay with them for a lifetime. Because one of the biggest things that dentists, or not dentists, but people believed back in the day was, well, my grandfather had dentures, so I'm going to have dentures later on. That's not true. You can, just because your grandfather had dentures does not mean you are going to have dentures. If you take care of your teeth, you eat right, you can keep your teeth for a lifetime. I have several patients in their 90s that have all their teeth still, and it is incredible, and it helps them a lot. Let's see. So another thing I want to talk with you about is how to care for your child's teeth or your baby's teeth. So one question that people ask is, when do I need to start brushing my child's teeth? And that is as soon as the first tooth appears in the mouth, and you need to start doing it twice a day. And I know that that can be a challenge, especially when you're breastfeeding or even just bottle feeding, and you have to get your child up in the middle of the night to feed, or he or she wakes up in the middle of the night. It's hard. At least during the middle of the night, try to get a little water on the teeth. If nothing else, just make sure that the milk is not sitting on those teeth all night long, because at night is actually when our bodies produce the least amount of saliva, which is why a lot of times you wake up in the middle of the night and your mouth is dry and you're thirsty. So it's the same for kids. So you just want to make sure that that milk or formula is not sitting on their teeth and causing cavities. And another really important thing when you're brushing is to use fluoride toothpaste. I know people get scared of giving their children fluoride and causing fluoridosis, but we recommend for kids from birth to less than 3 years old, use a smear or grain of rice size amount of fluoride toothpaste on the toothbrush, which is teeny tiny bit, and it's not going to hurt your child, it's not going to cause any issues. And then once they're 3 to 6 years old, you can bump that up to a pea-sized amount of fluoride toothpaste. But the fluoride is really important. It helps protect your child's teeth from cavities. And it's also really important, depending on what county you live in Alabama. Not every county in Alabama has fluoride in their water. So if they're not getting it in the water that they're drinking, you really need to make sure that they're getting it when they're brushing their teeth. And it's really important that you're always assisting your child or performing the tooth brushing for your child. A good rule of thumb on when to know if your child is old enough to brush their teeth without supervision: give them an Oreo, let them eat one Oreo, and then you'll see all that black cookie crumbs stuck to their teeth. Let them brush their teeth. If they can get all of that off of there, out from in between all their teeth, and you don't see any evidence left, they're old enough to brush their teeth without supervision. If you have to go back behind them still and get rid of the rest of the cookie crumbs on their teeth, then they're not old enough to brush their teeth by themselves. For some kids, that could be into their teenage years. It's just really important. You have to stay on them, or they're not going to be able to keep their teeth for their whole life. And it's totally fine to let them practice, let them brush first, and then you go back behind them afterwards and get what they miss. I'm all for that because it promotes them learning how to do it. And my daughter loves doing it. She really hates when I do it afterwards, but you just really have to do it for them. Also, it's really important, like I was talking about, to provide those healthy foods and snacks for them. If don't offer juices or soda, there's no reason that a child should have juice or soda. If you don't introduce it, they're not going to want it or crave it. Stick to milk and water. Try to, like I said before, try to only offer milk at meals and snacks, and then give water in between, but do the best you can with that. And then bring your child to the dentist every 6 months so that we can keep an eye on things and kind of help you and educate them. And we'll just help each other. So these are my sources. And thank you guys so much for listening. I really appreciate you having me on. Like I said, my name is Chelsea Maniscalco. If you want, you can follow me on Instagram at dr.chelsea.maniscalco. And I've also provided my email address, ashworthcm9@gmail.com. If you'd like to ask me a question or have any follow-up, feel free. On my Instagram, I kind of post some of my work. Sometimes I post little fun facts about dentistry. So it's just kind of, I'll post some stuff that we're doing in the office, just other things like that. And then also, if you need a dentist, like Miss Mason was saying, I am one of the dentists at Caldwell Crossings Dentistry. And you can call and schedule an appointment with us by calling our front desk, and our phone number is 205-991-5343. And Corey or Caroline will be happy to help you. You can ask for me, Dr. Chelsea, or for Dr. Milazzo. Either of us will be happy to see you. And we'd love to take care of you and help you with any of your dental needs.
Yes, this was awesome, Dr. Chelsea. I had another question about flossing.
Oh, yeah.
And there are different types of things you can floss with. Is the string, which one is better? Does it matter as long as you're doing it?
As long as you're doing it, I'm happy with anything that you use. For kids, sometimes I recommend those flossers that kind of look like a Y and they have a string in between them, just because it's easier for you as the parent to get back in their mouth with it. Because I have no idea how I would get my hands inside my daughter's mouth to floss in the back. But just make sure that you're getting in between each tooth when you're flossing. And if you're using a loose piece of string, you want to make sure that you're creating a C shape around each tooth. And if you have any like bridges in your mouth, which a bridge is something where it's like a crown, but it replaces multiple teeth. So you'd have like 2 teeth and then a fake tooth in the middle. And it's still really important to floss around the fake tooth around those regular teeth. And a lot of people don't like to do that because it's a pain. You have to have a little special flosser that looks like a needle for threading, but it's really important that you floss around those if you want to be able to maintain your bridge.
Yeah. And then let me ask you, because I know that typically we're supposed to come every 6 months. So if someone is having, or are there any special cases where someone should come more often? Not the periodontal disease. I know we talked about that, but is there anything else or any other issues where somebody needs to come sooner besides periodontal?
Yes. So some other reasons we may tell you to come more regularly when you're in braces, especially like kids and teenagers in braces, we may recommend that they're coming every 3 to 4 months just because it's hard to clean around those brackets, and kids are notorious for not doing a good job. And it's one of the most important times to keep your teeth clean because all of those brackets and wires just harbor food and plaque and can cause lots of cavities and also can cause something called white spot lesions around the areas where those brackets are. So when they take off the braces, you have all these little white spots on your teeth. So we just really want to help prevent that when we can. Another reason we may recommend that is just for sometimes for older patients that may be in like assisted living or in a nursing home situation where they're not able to clean themselves well anymore and or the healthcare providers aren't really doing a great job of helping them. We may recommend that they come more often just so we're like keeping an eye on things, but also like making sure that we can help keep them clean more regularly.
No, that's good. This is, I think one last question as you were talking, I was thinking about this, the last one for real. So I noticed one time or a couple of times when I go to the dentist that dentists are now screening you for oral cancer. Could you touch on that just for like a minute or two?
Yes, absolutely. So when you come to the dentist, every 6 months, I'm checking and doing an oral cancer screening. Once a year, we have this device that we use that will give you these funky looking glasses to put on, and we shine this blue light in your mouth and it will light up, regular areas of your mouth will light up and areas that are suspicious will be darker looking. And so we do that once a year, but every time you come in for a cleaning, I'm looking visually to see because oral cancer is very prevalent. Your dentist is most likely going to be the first person to find it because we're in your mouth twice a year. And I mean, your doctor isn't looking in your mouth most times unless you come to them and say, hey, I've got this weird spot on my tongue I want you to look at. And some of the biggest risk factors for oral cancer are smoking, smokeless tobacco, alcohol. Anyone that fits into those categories is higher risk for oral head and neck cancers. And they're very nasty cancers. They're very hard to recover from. The surgeries I wouldn't want anyone to have to go through anything like that if they didn't have to. And it's very life altering if you do get diagnosed with something like that. So it's better to catch it very early if possible. And that's why we do it every 6 months.
Well, thank you so much, Dr. Chelsea. This was so informative. I know our viewers have enjoyed this. Of course, guys, don't forget y'all can follow her on Instagram and the information is still on the screen, but at Dr. Chelsea, and their last name is spelled Maniscalco. Calco. Yeah, that's it. And then her email address is on the screen as well. She is with Caldwell Crossing. So please feel free to reach out to them. That's who we go to as well. And so we're going to end. I am going to show just a few announcements for our viewers, and then I'm going to have Dr. Chelsea just hang on for just a minute and just give one more minute of just something that we can take away and leave with.
Absolutely.
Okay. All right. All right, everyone. Thank you for joining us on today. Of course, it is the year 2022, the year of new beginnings. So we are believing God that He is going to create some new things in your life. Of course, don't forget, we are on One Place. If you want to get some more great teachings and some more great preaching from Pastor Mason, please go to oneplace.com. Do a search for Dr. James H. Mason III, and then you can actually look at all of the messages that are archived from him. Also, our prayer room call is every Monday, Wednesday, and Friday at 6 a.m. That number is 727-731-0433. Also, every Tuesday, we are studying the scriptures. We are walking through the book of James. So thank you for joining us every Tuesday at 11 o'clock a.m. Central Standard Time. Don't forget, we stream live several ways. We are on YouTube, we're on Facebook, we're on Twitter, and we are on Instagram. We are also on the My Sunday app as well. To receive text messages from Birmingham Bible Church, please text BBCWW to 94253. Text BBCWW to 94253. And then one more announcement. Don't forget our upcoming college virtual tour. For those of you who are you don't know what school to go to, maybe you just need some information, some insight. We have a couple of colleges that are going to be live, that are going to be talking to you about their institution. So that is going to be March the 19th, which is a Saturday at 10 a.m. In the morning. No need to register. We will actually have it shown on all of our social media pages. Of course, there are various ways you can give to Birmingham Bible Church. Our website is bhambc.org. All that information is on our website. You can give via Givelify. You can mail your contributions in. You can give via text, and you can also give via Cash App, which is $BHAMBC. Thank you so much, guys. Thank you for joining us here on today. It is our prayer that you receive some great information from Dr. Chelsea of Caldwell Crossings. Dr. Chelsea, if you can leave us with just one more, just some more information about how it's so important to take care of our oral health.
Yeah, absolutely. Like I said, I really appreciate you guys having me on. One other thing I can think of is it's really important to take care of your teeth, because if you don't, you're not going to have anything to smile with. And that's going to be one of the first things that people notice. I don't know if you guys have seen that cartoon out there, but there's a person with their eyebrow missing and a tooth missing. And the first thing that you notice is they're missing a tooth before you see they're missing an eyebrow. So.
Oh, you're right. You're right. Oh, well, thank you so much. This was so great. Thank you for joining us, Dr. Chelsea. I probably had some other questions. I said, let me stop right now.
No, I was happy to answer them.
We are definitely going to have you back. I think it's really important, like you said, for children, so important, because our first two didn't have to have braces, and you guys caught the last two. The last two had to have braces, and we had spacers, and we had all the stuff. We still have one that's in braces right now. But it's so important, because you all can catch that kind of stuff. You know, you can catch one of our children, his bottom jaw was growing faster than his top jaw. And you all caught that. We can tell his speech was different, and just kind of like, why is his speech different? But anyway, once we went to orthodontist and got all that rectified, and now he doesn't have the headgear and the braces or what have you. But anyway, thank y'all for what you do. Thank you so much. And so, guys, make sure you contact Dr. Chelsea or Dr. Malazzo, Caldwell Crossing. Wonderful people, wonderful dental hygienists. So that's all we have today. Thank you so much, guys, and have a great rest of your Wednesday. Thank you, Dr. Chelsea.
Thank you so much. Thank you for having me.
Thank you. Yes, ma'am. We'll have you back. Okay.